So we will give you the details, his details. And thanks, Myrna, for doing such a great job for GPON. Now we're going to move on to our next session, which is I hope at the break you got up, you really got out your chairs and had some exercise. And this is going to be emotional exercise, because as cancer nurses, we've got many emotional hazards in our workplace and in our work. And so we're going to have an interactive session with Ammar Zehreddine, and he's from Beirut in Lebanon. Hi, Ammar. So we've got to get all going. So Ammar has as well as being well experienced, well read, well published in emotional health. Ammar has also been a clinical nurse specialist for many years in hematological malignancies and stem cell transplantation. And I'm going to hand over for this interactive session, and we're all ready and waiting. Thanks, Ammar.
Thank you, Annie. I don't think I'm able to share my slides.
Okay. So we have your slides, Ammar?
I think I got it.
Can you try again,
fine.
Ammar?
Yes, I think that works now.
Well done. Okay.
All right. Good day, everyone. I'm really thrilled to be with you today. And before I dive into today's topic, I'd like to express my gratitude to the organizing committee of this venue for inviting me to speak. And it's a true honor to be with you today. And as oncology nurses, I acknowledge your dedication and your hard work, often going above and beyond to provide the best care and support during the most challenging times of the patients' lives as well as your lives. But today I'd like to shift that focus inward onto ourselves and talk about a subject that is as important, which is self-care. And to start with, I have nothing to declare. And in this presentation, we will cover the following key areas. We will cover the common challenges we face at work and the effect of these challenges on our health, the importance of self-care, and the practical strategies on how to build a sustainable plan for self-care. My hope is that you will leave today's session with some practical tools and inspiration to nurture your own well-being, so you can continue doing the incredible work you do, feeling more energized, more fulfilled. Let's get started. This quote by Goethe is a reflection on the deep influence that our passions, our values, our emotional attachments have on our identity, on our well-being, and the way we navigate life. And this idea can be applied to the context of self-care, especially in professions like oncology nurses, where compassion, where resilience, the emotional labor play a significant role. Goethe's quote speaks to the power of what we love and what we deeply care about, shaping not only our personal identities, but also the way we approach our work and our self-preservation. And it is said that one cannot remain in this work without being wounded, and caregivers who function only as technicians, who do not instinctively offer their souls, their hands, their hearts, will not thrive. And on the other hand, those who serve well, they operate from a position of tenderness and somehow vulnerability until they are able to look after themselves. Then we can be called the wounded healers. And there are three main categories of stressors or causality of stressors when one does the work we do: the personal, interpersonal stressors, the work-related stressors, and the environmental stressors. And sometimes the stress related to the workplace can carry a bigger magnitude than that coming from the patient's demands. We work with dying patients most of the time, not just because their cancer isn't curable, not because we don't have the right diagnostics and the right therapeutics, but for many other reasons. We have late diagnosis, we have late referrals. Our patients go into remission, but they fall septic without being salvaged. And unfortunately, we have our own grief that might not be well processed. Every now and then, it normally floats up to the surface. At times, we identify with a patient or with a caregiver or whenever a situation looks familiar to us. So, these are personal, interpersonal stressors. We also have work-related stressors. We have a high patient load. The straightforward chemo patient does not come to the inpatient wards any longer. They go to the outpatient nowadays. So we are left with newly diagnosed patients who come with an oncologic emergencies. And we have institutional demands, we have quality reports, we have accreditation demands, we have new policies that we need to read and sign and be trained for. Our resources are low, and we have new staff, and they demand our care. They demand a lot of energy from preceptors and mentors. And unfortunately, we have too much supervision with lack of support. They don't come hand in hand. And of course, bullying is still there wherever you go. Horizontal violence is there. Um, we have big units. We are assigned to different patients, and we have to run the unit back and forth all day long. Uh, Unfortunately, I heard a while ago some of us are still uh, expected to prepare chemotherapy or have an exposure to radiation, which is unsafe by all means. In my country, in Lebanon, we are working in a war zone, and the population have set their priorities different from what the normative needs are. Patients do miss their treatment cycles, and their cancer, unfortunately, doesn't wait. We are worried that the workplace might not be as safe as it is used to be. Some of us are displaced and cannot reach work, or we stayed at work while our families are struggling with displacement. So that all adds up to our stressors. And these stressors put a toll on our physical health, um, as well as on our mental health and emotional health. And ignoring these stressors and the risk they pose on our biopsychosocial being without healthy interventions, that is not just individual, but in a more collective way, that leaves a mark that makes us vulnerable for impaired functioning as well as for clinically significant distress. So we talk about mental health. And this quote from Shakespeare, "We are not ourselves when nature, being oppressed, commands the mind to suffer with the body," it speaks to the profound connection between our physical well-being and our mental state. And when our bodies are worn down, whether from exhaustion, stress, or even neglect, it inevitably impacts our minds. And in the demanding field of oncology, where nurses are often exposed to high levels of emotional, physical stress, self-care is not any longer a luxury. It's never a luxury. It's a necessity. And prioritizing that self-care, it helps. The prioritization of self-care helps ensuring that the body and the mind are aligned, and that allows us to show up fully, not just for our patients, but also for ourselves as human beings. And as we care for patients holistically, we need to see ourselves as in that sense, in the biopsychosocial sense, and treat not just our bodies but ourselves as a whole. And the components of self-care include the physical aspects that has behaviors to promote bodily health, such as exercise, rest, sleep. You eat well, you regularly exercise and have a regular medical follow-ups. And this also includes the emotional self-care that involves strategies to manage stress and process emotions. Um, particularly those related to patient care and to loss, and that include mindfulness, journaling, therapy, and setting boundaries. And for the mental aspect of self-care, this includes setting goals, personal growth, professional growth, and staying up to date with the knowledge, with the continuing education. You engage in hobbies or taking part of an activity, and this is not just the mental act, but the intellectual act. And personally, if I'm not challenged with a new knowledge, I don't see myself as productive. So getting to know things, more things about my work, it allows me to do my job better. And we also have our social networkings of family and friends, colleagues and mentors. And for some of us, engaging in practices that offer spiritual fulfillment, meditation, a religious practice, a prayer, or even volunteering is integral to our overall well-being. And the responsibility of maintaining self-care is not individual; it's collaborative, and it surely starts with us, with you. Setting boundaries to balance work and life, you schedule breaks, you take vacations, and you utilize available wellness resources. We practice self reflection and help yourself identify a burnout early. Institutional support, if we have now, today, if we have people on this forum in a managerial role, please remember that quality checks, accreditation processes, the adherence to policies are really super important to our institutions. But for getting the word support next to that of supervision will get you that accreditation once or twice with the same people that you have. Then you will need a new batch of nurses to teach and train, because every time you warn them out, you warn the staff out, this backfires on you when it comes to staff turnover. Those who stay are the ones who are not as who would like to be challenged and are not as interested in professional development and professional growth. So support your staff, practice those staffing tricks that you can get them uh, without violating the institutional policies. I know you have a lot of tricks up your sleeves. Help your staff balance their work and their life. Eliminate bullying and acknowledge the needs of those staff. And of course, training programs that teach self-care can be critical, and should be incorporated to the institution. If you don't have these ongoing surveys, the continuing learning needs assessment, then you probably need to create them and address them to your managers, to your superiors. Tell them what you really need.
Ammar, apologies. I think you're on mute.
Sorry.
And you'll need to share your screen again.
So we are going to have a practice exercise, and let's just take a moment to center ourselves with a brief mindfulness activity. This is a simple practice that you can do anytime during your day to help manage stress. And it will take less than 5 minutes, and it's a great way to refresh your body and your mind as well. Um, Try to sit wherever you are. Try to sit comfortably, whether you are in a chair or on a sofa or on your desk. Have your feet flat on the floor and hands resting on your lap. and we rarely sit with feet flat on the floor. If you feel comfortable, gently close your eyes and keep a soft gaze in front of you. Now bring your attention to your breaths. Take a slow, deep breath in through your nose and exhale gently through your mouth. Notice the sensation of the air filling your lungs and the rise and fall of your chest and abdomen. Let's repeat for a few breaths. Inhale deeply and exhale. And as you breathe, allow any tension in your body to melt away. Simply focus on the rhythm of your breathing. And let's do that for 4 or 5 more breaths. If your mind wanders, gently bring your focus back to your breath. And it's natural for thoughts to come and go. Just acknowledge them and return your attention to breathing. Now shift your attention to your body while breathing. Start at the top of your head and notice any tension in your face, jaw, or neck. As you breathe out, imagine that tension melting away. Move your awareness to your shoulders, to your arms. Let them relax with each exhale. Continue scanning down your torso, back, pelvis, thighs, legs, and feet, releasing tension with each breath. Now slowly bring your awareness back to the room or space around you. Wiggle your fingers, your toes gently, and when you are ready, open your eyes and take a moment to notice how you feel. Now we always discuss empathy as a prerequisite for self-care. If we don't feel with the patient, if we don't understand the patient's feelings, the patient's emotion, that um, that might not help us and not help the patient. And when we talk about empathy, the term sympathy always comes along. And here we need to differentiate not between empathy and sympathy, but between cognitive empathy and affective empathy. If we just practice affective empathy, that leads us back to sympathy again, and our processes won't be as effective. We need to practice more of a cognitive empathy, understand the situation, and then try to understand how this patient feels. Sometimes just understanding the situation will allow you to help the patient more. So we need to be able to practice both cognitive empathy and affective empathy. And for those of us who are not well in touch with their emotion or have a maladaptive pattern in processing their emotion by putting them in an unimaginary box and leaving that box on the highest shelf of their closet, have a look once in a while on that wheel of emotion and try to figure out how does that certain situation made you feel. Get used to it because you are less likely to be able to spot an emotion in a patient and help them process that emotion if you haven't processed your own. It might take a while and it might be a little painful to start, but you will get there. If you are still unable to getting some counseling with a trusted professional might be of a great value. And when you are faced with a difficult situation arising, difficult emotion, don't be hesitant to use the mnemonics nurse. Identifying and naming the emotion that the patient or colleague is experiencing, show empathy and understanding towards the patient's emotion, acknowledge that person's feelings and show respect for their emotion, offer support and show that you are there for the person emotionally and physically, and encourage further discussion about the emotion. That's the explore part. So that's a very good mnemonics to remember, and it's very good to use when we are facing difficult emotion, a situation with a difficult emotion. And although this is unknown, but it beautifully encapsulates the essence of coping, adaptation, and resilience, particularly in challenging circumstances. Resilience is not just about adapting, but and it doesn't relieve the situation when we say we are resilient, but it's working around what is more positive in our lives and use it to survive that storm, that situation, and that difficult situation. So we face significant emotional and physical challenges due to the nature of our work, which often involves caring for patients with time-limiting illness, and this makes resilience a crucial skill. Assessing and building resilience helps us remain effective in our roles and reduce the risk of a burnout, for compassion fatigue, and of course the turnover. This is being able to manage one's emotion in highly stressful or emotionally charged situations. It's engaging in regular activities that store mental, physical, and emotional health. It's having strong connections with peers, with family, with friends, and with the healthcare team. It's to set boundaries as well between what is professional responsibility and personal life, and it's finding fulfillment and purpose in the work, which really helps maintain motivation. And beware not to indulge in habits and patterns that are not always healthy when practiced at large. We say that wine is only sweet for happy men. And by analogy, I can say so is smoking, so is binge eating, so is binge watching TV, and so is sleeping all day on your day off. And on my first few travels, I used to listen carefully to all safety instructional videos, to demonstrations, and then I started to snooze the minute I hit on my seat. And it took me a while to translate that oxygen masking to nursing life and helping others. And it took me a while to realize how true it is. Sometimes you need to prioritize yourself before others. If you can't help yourself, it's very unlikely that you will be able to help those around you. And we are now going to take a short break, trying to a guided imagery exercise. That's one more exercise. This will help you relax, clear your mind, and refresh your energy. So again, sit comfortably, place your feet flat on the ground, your hands on your lap. If you are comfortable, gently close your eyes and soften your gaze. Now imagine yourself standing on a beautiful, peaceful beach. The sky is perfect blue. You can hear the gentle sounds of the waves rolling into the shore. Feel the warmth of the sun on your skin and notice the soft sand beneath your feet as you walk along the shoreline. With each step you take, feel yourself becoming more relaxed and more at ease. Breathe in deeply and imagine the fresh sea air filling your lungs, bringing calm and peace with each breath. As you exhale, let go of any tension or stress. You are safe, calm, and completely relaxed in this peaceful place. Enjoy the soothing sounds of the ocean and the gentle breeze on your face. Now take one more deep breath, letting the peaceful feeling stay with you, and slowly begin to bring your awareness back to the room around you. Guided imagery is a quick and effective way to relax, and you can practice that in a group. You can turn on a slow-paced music of your choice if you like. You can assign yourself or someone else to guide the group, and you can use the scenery of a forest, a garden, a hill, a meadow, top of a mountain, or whatever environment that you feel soothing. From where I started, I would like to end. Goethe's insight that we are shaped and fashioned by what we love is an invitation for us to reflect on what we really value, on how those values impact our ability to care for others. And in the context of self-care, this means that by nurturing the love we have for ourselves, for our work, and for our lives outside of nursing, we can build resilience, we can protect our emotional well-being, and we ensure that we are able to continue giving our best to patients. By prioritizing self-love and well-being, we can regain our agency to stay emotionally healthy and maintain the passion that initially led us to our call, to our profession. This is my contact. If you would like to establish a contact or to ask a question or to discuss more about any of what I've said today. And I thank you very much for your listening and for being here today.